Hello, I'm Neil King. I'm the owner of Neil King Physical Therapy. Our original clinic is here in Rochester Hills, Michigan, and we have 10 clinics in the southeast Michigan around the Detroit area. I started working at Providence Hospital. I worked there for 3 years, knowing that I was going to open up my own practice in Rochester, Michigan. Started my own practice in Rochester, Michigan in 1998. At first it was a little bit slow, but when I started getting people to come in, they had such good results, they would go back and tell their doctor, and the doctors started sending people into me. We worked out of a 2,000 square foot office and quickly outgrew that and came to this larger office in Rochester Hills in 2006. When you're at a hospital-based setting or in another physical therapy setting, you're kind of working a regular routine in terms of how patients are treated. I wanted to use more of the soft tissue mobilization techniques that I had learned, and I wanted to give more hands-on, one-on-one therapy. And so I decided to open up my own clinic for that reason. The continuing education is a big thing in our practice because, like I said before, there isn't one therapist that knows everything, and there isn't one thing that fixes everything. So having the wide variety of techniques and therapies and specialties in our practice really makes a big difference in terms of the quality of the outcomes. It's the Rolfing techniques, the soft tissue mobilization techniques. We have cranial sacral, we have LSVT big, we have OMPT specialists. We also work with pediatrics. We have a fairly comprehensive women's health program for pelvic floor incontinence. It's both women's health and men's health for that, and a variety of other things. I am a bicycle racer, and I also used to work on my own bikes, and I very often make comparisons of the body, human body, to a bicycle wheel, in the sense that when you have something wrong with the wheel, and you can't go and just fix it by tightening or loosening one spoke. You have to adjust it with all the spokes in the wheel in order to make it work properly. And it's the same thing with the body. I started cycling, got my first 10-speed right out of high school, and did really, really long distance rides and nothing but my shorts and my tennis shoes. And then I switched schools from Flint Community College, which is now Mott Community College, to Michigan State. And when I got to Michigan State, I found they had a cycling club. And I got into the cycling club, and it was a racing club. I really just took to it. I loved it. In my very first race, I got third in the race. And then a couple months later in the Michigan State Championships, in the track championships, there were 3 events, and I wound up winning all 3 of the events. And so total, I have gone to the state championships 20 years, and in those 20 years I won 31 medals. 13 of them were gold. And I was second in the nation twice and third in the nation twice. And I went to 2 Olympic trials and 2 Pan Am trials. I also coached for that almost an entire time of 20 years. And during that time, I coached probably 60 different people to state championships, 15 national champions, and 1 world champion. I raced bicycles competitively for 25 years. And a friend of mine had recommended that I try a form of bodywork called Rolfing in order to improve my performance on the bike. I was a national caliber rider, and just a few percentage points at that level made a huge difference in the outcome. So I tried the Rolfing. It made a big difference, and I was so impressed with the work that I thought, this is something I want to learn how to do. I applied to the Rolf Institute in Boulder, Colorado, and got my Rolfing certification in August of 1984. When my friend had recommended the Rolfing, what had happened is I went to the National Road Championships in Bear Mountain, New York. And true, I'm from Michigan, and there's not a lot of mountains in Michigan. But the climb, the first climb in the race was a 6-mile climb. And I wound up getting dropped from the pack right at the top of that climb. And it was very, very frustrating. But I came home, I went through the first 3 to 5 sessions of Rolfing, and then I went to the National Criterium Championships in Lima, Ohio that year, and I wound up racing against the same people that I rode against in the road championships, and I wound up getting third in the nation. And so the amount of change was substantial. I mean, my breathing opened up when I would have to go really, really hard to pursue people that were, breaking away from the pack. My recovery was much better. I caught them. My response time was better. Everything was better. It really made a huge difference in my performance. The future of Neil King Physical Therapy will be probably continuing to expand. We have 10 clinics now, and I'd like to expand out to probably 15 to 20 clinics and get it over a broader range of the Detroit area, the Southeast Michigan area. We believe that good structure and good posture has a really, really good health outcome. You have to have a holistic whole body approach and integrate whatever you're doing into the whole structure so that you have a much better quality outcome.